There are a number of ways diabetes insipidus is diagnosed. For instance, a fluid deprivation test can help differentiate between the types of diabetes insipidus, including an ADH production defect, central diabetes insipidus, a defect in the kidney response to ADH, nephrogenic diabetes insipidus, or excessive fluid intake, primary polydipsia. The test will measure changes in urine output and urine composition when fluids are withheld. Sometimes blood ADH levels are also measured during a fluid deprivation test. Diabetes insipidus is also sometimes determined when urine is less concentrated in a urinalysis test. A magnetic resonance imaging (MRI) of the brain is also considered a non-invasive test that can help detect pituitary gland abnormalities related to central diabetes insipidus. Genetic screening may also be suggested in those with a family history of diabetes insipidus. Without diabetes insipidus treatment, the condition can lead to fatigue, weight loss, increased heart rate, low body temperature, chronic dehydration, consistent headaches, low blood pressure, brain damage, and kidney damage. The most common conventional treatments will depend on the type of diabetes insipidus. Central diabetes insipidus treatment is usually desmopressin, a synthetic replacement for vasopressin that reduces urine production. People should only take desmopressin as needed, since taking excessive desmopressin can result in low sodium levels in the blood and large amounts of water retention. Low sodium symptoms include nausea, confusion, lethargy, and possibly seizures. Nephrogenic diabetes insipidus, desmopressin is not a treatment option since the kidneys are not functioning properly from ADH. The main treatment options include water intake to avoid dehydration, a low-salt diet to lower the urine made by your kidneys, and a low-protein diet. If symptoms don't stop, drugs are often given to reduce urine output, including thiazide-diuretics, amiloride, and non-steroidal anti-inflammatory drugs, NSAIDs. Gestational diabetes insipidus, desmopressin is also used to treat gestational diabetes insipidus. The noted side effects of desmopressin include nausea, belly pain, headaches, vomiting, sudden face redness, and a slight increase in blood pressure. In rare cases, gestational diabetes insipidus is caused by a thirst mechanism abnormality, and in these cases desmopressin is not prescribed. Primary polydipsia. The main diabetes insipidus treatment method involves reducing your fluid intake. However, when mental illness causes primary polydipsia, treating the mental illness may relieve the primary polydipsia symptoms.